So today we will be discussing the classification of synovial joints. Synovial joints are a variety of diarthrosis or the cavitated joints. First of all, the first classification is based upon the complexity of the joints. So joints may be simple, they may be compound, and they may be complex joints. Simple joint is the one where there are two articulating surfaces. For example, the shoulder joint, it has one humerus, head of humerus that is articulating with the scapula. So the two bones are articulating, and this is an example of simple joint. A compound joint is the one where there are more than two articulating surfaces. For example, the elbow joint. What happens in elbow joint? That the lower end of the humerus that articulates with the radius and the ulna. Third variety is the complex joint. What happens in a complex joint? That there is an intra-articular disc present. The example is sternoclavicular joint and the temporomandibular joint. Another example is of the meniscus that is present in the knee joint. So this also makes the knee joint a complex joint. Next classification is based upon the degree of freedom of movement. So the movement may be in one axis, it may be in two axes, or it may be in three axes. So the joints are uniaxial or biaxial or triaxial. The three planes of movement are the vertical axis, the transverse axis, and the anteroposterior axis. First of all, we discuss the uniaxial joints. In these joints, there is one degree of freedom of movement and it takes place around one axis. Typical example is an interphalangeal joint and the knee joint as well as the elbow joint. So here we can see the movement at this elbow joint is an example of uniaxial movement. The flexion and extension, this happens in the uniaxial joints. Here we can also see that in upper limb at elbow joint, the flexion and extension, this happens in one axis, the transverse axis. So this is an example of uniaxial joints. Now, biaxial joints have movements in two axes. For example, the wrist joint. Wrist joint has the movement of flexion extension as well as adduction and abduction. Here we can see that the wrist has flexion extension as well as adduction and abduction. So the movement is in two planes. So this is an example of biaxial joint. So what happens in multi-axial joints? The movement is in three planes, and the typical example is a shoulder joint. Here, one movement is in the transverse axis, one movement is in the longitudinal axis, and one movement is in the anteroposterior axis. So all the movements, the flexion extension, lateral rotation, medial rotation, and abduction adduction occurring at the shoulder joint makes it a multi-axial joint. The next classification is based on the gross morphology. So, morphologically, the joints are classified into plane joints, hinge joints, pivot joints, ellipsoid joints, bicondylar joints, sellar joints, and the spheroidal joints. We'll discuss these one by one. First is the plane joint. The flat articulating surfaces are opposed with each other. Typical examples are the joints between the carpal bones and the tarsal bones. The opposing surfaces are plane or flat, and a slight gliding movement is possible in these joints. Next variety is the hinge joint. What happens in the hinge joint? That the articulating surfaces have reciprocal convexity and concavity, and the articulating surfaces, they resemble a hinge, hence the name hinge joint. And the typical example is the interphalangeal joints and the knee joints and the elbow joints. These are also the uniaxial joints. The movement is only in one plane. So they are the examples of hinge joints. This is an elbow joint and the movement is in one plane. Only flexion and extension is happening around the transverse axis, making it a hinge joint. Next is the pivot joint. These are uniaxial joints and they have a central bony pivot surrounded by an osteoligamentous ring, and the movement is in the form of a rotation. So there are two examples of the pivot joint. First is the movement at the proximal radio-ulnar joint, and the other example is the movement around the atlantoaxial joint. Next variety is the ellipsoid joint. These are biaxial joints and the movement is around two axes, the transverse axis and the anteroposterior axis, as I have told you earlier in biaxial joints. The example is wrist joint. Here, flexion extension is occurring as well as the abduction and adduction is occurring. So these are the examples of uh, ellipsoid joints. The fifth variety is the bicondylar joint, and we can see that the name, as the name indicates, this movement is between the condyles. So condyles of the humerus, they articulate with the radius and ulna. So that is an example of condylar joint, and the condyles of the femur, they articulate with the tibia. So that is another example of the bicondylar joints. Next joint is the saddle joint or the sellar joint. The articulating surfaces are in the form of a saddle and they articulate with each other. A typical example is first carpometacarpal joint. Here we can see the articulating surfaces are in the shape of a saddle. So this is an example of um, saddle joint. The last one is the ball and socket joint, also called the spheroidal joint. Here, the ball, that is the head of the bone, articulates with the socket, that is the acetabulum. This is an example of ball and socket joint. This is hip joint, in which head of the femur is the ball, which articulates with the socket, which is the acetabulum. So this is an example of ball and socket joint or spheroidal joint. Another example is the shoulder joint. Now we'll discuss the factors which are responsible for stability of the joint. The first of all is the tone of the muscles. All the muscles that are crossing that particular joint are strengthening that joint. For example, the knee joint and the shoulder joint, all the joints, in fact, all the muscles that are surrounding the joint are strengthening the joint. The next is the ligaments. Obviously, all the ligaments that are attached to the joint help in containing the movement of that joint. It prevents the excessive movement and guards the accidental stresses to the joint. Next is the articular discs and menisci. They also prevent the excessive movement and protects the joint. Finally is the shape and size of articulating surfaces. This is very important. If the shape and size of the articulating surfaces is not appropriate, dislocation will result. So this is an important factor for strengthening a joint. Next is blood supply of synovial joints. Blood supply of synovial joints is by the branches of the arteries that are making anastomotic channels around the joint. So what happens is that the joints, and that I have told you in my previous lectures that the epiphyseal arteries were the arteries of the joints surrounding that particular area. So these arteries, which are making anastomotic channels around the joint, they supply the joint. What happens is that if there is a specific movement of the joint and some vessel is compressed, this anastomotic channel doesn't let the blood supply to get disrupted, and the blood supply to the joint remains intact, and this is the anastomotic channels are very important in this manner. Next is the nerve supply of joints. The joints are supplied by sensory nerves and they perceive proprioception as well as pain. That's all for today. Thank you.